Bring your brows really hard together, like you're scrunching. Perfect. All right, and then raise your eyebrows up really, really high, and then squint your eyes shut really, really tight. Okay, perfect. How has the Botox we've done in the past been working for you? So just reviewing Robert's chart here so we can look over what he's had done in the past and then evaluate how this has worked for him and come up with a plan. If it's any different from what we've used before, we'll adjust it. If not, we'll continue on doing this if this is what's worked for him. So today we're going to be doing some Botox for you. So I'm going to hand you a mirror so you can bring your brows really hard together like you're scrunching. Perfect. How has the Botox we've done in the past been working for you to eliminate the lines and get you the effect that you like to have?
It's been great.
Okay. Any concerns or questions? Do you feel like all of the areas have enough room?
Yeah, no, it's been wonderful.
All right, perfect. So we've done 40 units in the past. I'm going to stick with same pattern and things like that. So I'm kind of seeing where his musculature extends to. So the frontalis muscle generally runs for most people. There's a little ridge you can feel right in here. So raise your eyebrows up. So you can see his actually extends a little further out than most people. So when we're doing the Botox, we want to make sure that we're hitting the muscle where it lies to get the effect that we want. For men, obviously, we don't want arched brows, so we're trying to make sure we don't give him that effect because he doesn't want to have an eyebrow that looks like that, whereas women do. So that's why we're making him move, so I can kind of see where his muscles are, and I can also feel for them as I'm going along. If I can't tell, I'll have them contract. Contrast me, and I can feel the muscle contracting under my finger. Same thing up here where I was isolating the muscle groups when I was injecting. So with men generally do need more Botox than women. It's because their muscles are stronger. You can see men generally have more prominent muscles in here. We adjust the dosing based on what we see though, so that's not always the case with every man. So we adjust it based on what we see for him. We've come up with this amount based on his response phase. The other part of it too is that both men and women have different amounts of Botox that they desire to have the effect that they want. Some people want to have less movement than others, and some people want to have a little bit more movement and have a little more natural appearance. So all the Botox can be adjusted to account for that. Men also, like we said, don't want to have open eyes, arched brows. They want to have brows that are a little bit flatter. That's more of the aesthetic for men. But we adjust everything based on what you want. I can make your brows more or less arched. I can eliminate lines more or less depending on what you want, and we can always add more if you feel like it's not enough at any point. We can just add a little more Botox and knock out a little more movement. This is not a bad treatment. It's fairly comfortable. The pinch is pretty mild, and there's no burn afterwards, so it's very easy, especially if you're nervous about needles. It's very, very small. If there's anything that they don't like, or if there's any lines that they still want to get rid of, we can adjust the treatment, and about 7 to 10 days after this kicks in, we can get a better idea if there's anything that's left. And I always encourage people to come back if they need anything, and they have concerns or questions. So right here you'll see the fluid. This is just fluid from reconstituted Botox. It's just saline that will soak in a few minutes. Most of the time it's completely gone by the time they even make it to the next destination. Alright, so you are all finished. It's just that fast. And then this lasts around 3 to 4 months. So this is usually about 3 times a year.